How do combat lifesavers use occlusive dressings? Imagine a scenario where a soldier sustains a gunshot wound to the chest, and the bleeding is severe. In such critical moments, the actions of a combat lifesaver can mean the difference between life and death. One of the most vital tools in their kit is the occlusive dressing, a specialized covering designed to manage chest injuries effectively. But how exactly do they use these dressings to stabilize a patient and prevent further harm? When a combat lifesaver encounters a penetrating chest wound, their first priority is to control bleeding and prevent the development of a life-threatening condition known as a pneumothorax. This occurs when air enters the space between the chest wall and the lung, causing the lung to collapse. To prevent this, the lifesaver applies an occlusive dressing directly over the wound. These dressings are typically made of a non-porous material, such as petroleum gauze or specialized plastic sheets that are airtight. The process begins with ensuring the wound is as clean as possible, removing any debris if feasible. The lifesaver then carefully places the occlusive dressing over the wound, making sure it extends beyond the edges of the injury to create an effective seal. To secure the dressing, they use medical tape or adhesive strips along all four sides, ensuring the edges are sealed tightly to prevent air from entering or escaping. This airtight seal is crucial because it prevents the buildup of air in the chest cavity, which could otherwise cause a tension pneumothorax, a condition that can rapidly become fatal. In some cases, if the wound is large or irregular, a larger occlusive dressing or multiple dressings may be used to cover the entire injury. If the dressing is not self-adhesive, the combat lifesaver may need to reinforce the seal with additional tape or a pressure bandage. It is important to monitor the patient continuously, watching for signs of worsening breathing or chest movement, which could indicate that air is still entering the chest cavity. In situations where the injury causes an open pneumothorax, the combat lifesaver might also perform a procedure called needle decompression before applying the occlusive dressing. This involves inserting a sterile needle into the chest to release trapped air, providing immediate relief. Afterward, the occlusive dressing is applied to maintain the seal and prevent further air entry. Using occlusive dressings correctly is a critical skill for combat lifesavers, as it helps stabilize the patient, prevent further deterioration, and buy valuable time until advanced medical care can be provided. Their precise application and vigilant monitoring can significantly influence the outcome of a life-threatening chest injury.